Welcome to Lifestyle Matters. I'm Marilyn Amore. We are at IQ Vision Care with the newest doctor on the IQ team, Dr. Shute, and he is a fourth-generation eye care provider and also specializes in glaucoma and cataracts. And I know they're very happy to have him on the team, and we're happy to have him on the show. So, Doctor, welcome.
Thank you very much, and it's nice to be here, nice to be back home.
And I understand you've only been here for about 3 months, so why don't you tell us a bit about your journey and why you came back to the Central Valley?
Yeah, that's right. So I got here in July, which would put us about 3 months ago now. I was living in St. Louis with Heather, my wife, for 4 years before that. So it was, I spent some time in the Air Force. They stationed me out in Vegas, so I was there for 4 years. Then I went to do my residency and glaucoma fellowship out in St. Louis. So we were in St. Louis for 4 years, always with an eye on back home. So she's also from here. I married a Fresno girl. So me being a Clovis guy, her being a Fresno girl, we always kind of had our eyes back on the valley. And living in Vegas, living in St. Louis, you get to see a lot of the country, and we always were just kind of drawn back home. So it was great that IQ had an opening, and I emailed them, and they said, yeah, we'd love to talk to you, and it all worked out. So 3 months back home, and everybody says the weather here is too hot and all that, but I'm glad to be out of the humidity in St. Louis.
Oh, I bet. And, you said 3 months back home, your dad also specializes in eye care. He's an eye care provider. Why did you decide to choose, the glaucoma cataract route?
Yeah. So, growing up, I think being around eyeballs, you start to learn to appreciate how much of an impact you can have on somebody's life. And Dad gives glasses and contacts, which I had professors in medical school and residency that told me that you'd cure more blindness with glasses than you ever would with cataract surgery. But my dad being an optometrist in town, his dad being an optometrist in town, his dad being an optometrist in town, I really had no choice. So it was kind of just ingrained. I think I fought against it early on when I was going to medical school, and I was thinking, maybe I want to be an orthopedic surgeon, maybe I want to be an ENT doc. I did my first eyeball rotation, and I thought, man, this is really interesting stuff, and it sunk its teeth into me, and I the rest is history kind of thing. I think my experience as a flight doc in the Air Force, taking care of the pilots and the air crew, again, vision is so important for those guys, and the opportunity to optimize vision, restore vision is something that I really cherish. And we don't get the opportunity in medicine all that often to have a real tangible effect on somebody's life. So the idea that you can take a cataract out, or you can sort of help optimize somebody's vision with surgery was really appealing to me. As a primary care doc in the Air Force too, I had a lot of experience managing blood pressure, cholesterol, things that you need to take medicines for that you don't necessarily feel the impact right away. And I think that's kind of how glaucoma is. Glaucoma, you need to take medications or you need to do surgery and it's not necessarily that you're improving vision, but you're saving vision and you're preventing vision loss. So I had a little bit of experience teaching my patients about why they need to take a medication that's not making them feel any different. And I think that's probably why glaucoma really appealed to me. But the other thing nowadays with glaucoma is that we're in what we call the glaucoma revolution or a glaucoma renaissance, where we have a lot of new treatment options available, a lot of minimally invasive glaucoma surgeries. And I think that's really, really cool. So the opportunity to offer our patients something new, something cutting edge, especially here in the Valley, it's really, really nice.
I mean, you're a rebel from what you've been saying. I mean, you've brought something here that, a lot of people might not necessarily see, how you've trained and your background experience, because like you said, that really did influence you and how you chose to become specializing in glaucoma and cataracts.
Yeah. So I don't know about a rebel, but there's definitely a new way of thinking about glaucoma nowadays. And the newer generation of glaucoma surgeons really it's about being a little bit more aggressive, because we have opportunities to take care of somebody's pressures inside the eye and stave off that vision loss that the previous generation of glaucoma surgeons were really fighting against. So the opportunity to intervene early with minimally invasive procedures is something that is a great opportunity for us, and that's really what we focus on nowadays.
And why did you choose to come to IQ?
So I chose to come to IQ because, again, with my dad being in town, he had experience referring people to IQ in the past and had always had great experiences. And one of the first physicians that I ever followed around when I was in high school trying to determine whether I wanted to go to medical school or what I wanted to do with my life was actually Dr. Richard Morris, who's, long time staple of the community and has been practicing at IQ for his entire career. So me and Dr. Morris go way back, and the opportunity to join him in practice was something that I couldn't pass up.
And last but not least, what are you looking forward to most being back in the Central Valley?
Being back in the Valley is fantastic. Like I mentioned, Heather and I always had an eye back on home, and we would say things when we were in St. Louis like, man, we could just go up to Shaver or Huntington. We could be there in an hour. It's so nice to be so close to such amazing, beautiful places. St. Louis has its own stuff too to offer, but you drive an hour or two outside of St. Louis and you're still in the middle of nowhere. Here you got 2 hours. You can be in Pismo, you can be in Santa Cruz, and with even closer than that, you can be up at Shaver. We got Yosemite Valley a couple hours away, and Kings and Sequoia. So we're really looking forward to getting out and enjoying nature. And but the other thing that this place has compared to St. Louis is better tacos. So we're really looking forward to
Amen to that.
Getting back and enjoying some tacos, some good Central California barbecue. The tri-tip too, we really missed that when we were out there. So.
Well, Doctor, it was a pleasure speaking with you, and congratulations on joining the IQ team. Viewers, thanks for tuning in. You're watching Lifestyle Matters.